my topic is the recruitment to approval, unlocking and addressing the barriers to retention of African American families. Okay, so this is a wonderful quote that fits and so suiting for me. Passion is energy. Feel the power that comes from focusing on what excites you. What excites me is being in an organization where I'm truly fulfilling my purpose. And that's helping people win. That's being a voice for the voiceless. So, who is TRAC? We started off in 1978 as association through the Junior League. But through the years, we have grown to one of the largest full service private adoption agencies in Pennsylvania. We're the only agency in Allegheny County that gets paid for recruiting funds. And annually, each year, we service over 1,600 children and families. I would also add that we are a small but mighty organization having less than 40 staff. So TRAC is truly a service heavy organization. So as I've been listening to some of these wonderful presentations throughout the year, we're fortunate to be familiar with most of them. So under the Adoption Resource Services, that's where your role is educating the community on the need. We recruit families, we train them. We are contracted through Allegheny County and about 9 other counties to provide foster and adoption services. Under the Black Adoption Agency, we work with child-specific recruitment. We focus on family profiles and placement and supervision. But in addition, our prep and post-adoption services, which we're known for and have several speakers that present that on a national base. And our new baby is our outpatient mental health clinic. So we are licensed, credentialed, have a psychiatrist on board to provide services for families and children. So my PICO, my research question was, if we provided, if African Americans receive specialized and individualized support, such as aid with clearances, face-to-face paperwork assistance, immediate assignment to a profile writer, and ongoing supports through the approval process, will there be an increase in the retention rate as far as the approval rate of African American families? And I'll show you on the next slide why this was near and dear. This is a critical issue because our numbers were telling a story that wasn't reflective of what we were doing in 2018-19 fiscal year. We had 114 families call into our organization for intakes. Out of that, 46 of those families completed an orientation. From there, 21 started the classes, and then it just continued to go down, where only 14 completed. And then that year, we only approved 6 families, African American and of color. We knew that we had work to do. In the population, as far as African Americans in Allegheny County, the rate is 14%, but the number of children in care were 58%. And as you've seen on the previous slide, we specialize in African American adoption. What were we doing wrong? So there was all kind of assumptions that came to mind. Was it too many trainings? Right now, we have 33 hours of trainings, and that is looking to increase as new changes and policies are coming within the county. Did it need to be virtual trainings? Prior to COVID, it wasn't. So that was something that we looked at. A lot of paperwork, needed more staff. Was it financial assistance with clearance? We weren't offering childcare. Was the communication being relayed in an effective and a positive way? These were all the assumptions that we had came up with as a team. So on my literature review journey, it was challenging. There was tons of information regarding recruiting families, but limited on the retention through the approval process. I was able to find a great piece through the Foster Family Resource and Psychosocial Functioning System, which clearly made it sense that 50% of African Americans dropped out at the beginning of the process. And some of those reasons were lack of communication or that they were dissatisfied with the service. That rung near and dear to our organization. But also, another piece was Dr. Ruth McRoy. She talked about it at the celebration that her services were lined up where it was one worker, and that worker became a relative in a sense, and they made a positive impact. And it was that same worker that went throughout the entire journey from recruitment to approval. So my methodology consisted of a couple of ways. We focused on our TRAC staff, our families, our previous families. We did satisfaction surveys. So if you look for the staff section, we had 33 staff at that time, and I had a response rate of 36. For the families, we sent this out to 124 active families, and we had a response rate of 44%. Then we went a little deeper where we did some interviews. We called 43 of those families that were highlighted from fiscal year 18-19. From that, we were impressed to be able to have 5 families say that they were ready to start up again, and 3 currently are in that process. So as I started gathering my surveys, one of the questions I wanted to know was, what was their level of satisfaction when they initially called our organization? And you see it's a high between very satisfied at 66% and satisfied at 31%. So at 98% average, people were really pleased with the initial phone call that they received. Then I wanted to know what was their knowledge about the process prior to calling. And you'll see at the 30%, this people were somewhat knowledgeable about this process. We also asked them, after completing the orientation, how satisfied or were they about the material and information they learned? And you see there's a huge piece at 42% were satisfied to a great extent, and quite a bit at 43%. So again, high numbers of saying that we were communicating and explaining to the families in a way that they were understanding what to expect in this process. Some of the themes that came out of our of the surveys for families was communication. They said that it was either great or that it was lacking in some areas. That staff were involved in every part of the process. And then there were some concerns with the matching department may not following through in a timely manner. They felt as though our trainings were high quality and they were beneficial, but then some people said enough is enough. This is 5 Saturdays of my time. I'm training overload at this point. Other feedbacks that I thought was good was great staff, but one in particular that we laughed throughout the journey was, who in the hell is Tom? This was a family that had started the process in 18-19, however, stopped for whatever reason. And then once she started back up, she failed to realize the different steps. And then there was this Tom person calling who just happens to be our profile writer. And it was just too much, too many people, too many steps, and she was overwhelmed. Staff, on the other hand, some of the feedback was that 98% said that we provided culturally competent services. So we felt great about that. But another piece is, as we're growing, they felt as though we needed to provide additional and ongoing trainings about the intake and approval process, so new staff were informed. So as mentioned, a part of the interviews, we were able to pull some case studies together, and that's what we're going to talk about now, why this time is better. So the first one is Miss Simon. Miss Simon had started this process in May of 2019, and for whatever reason stopped the process. I'm going to use pseudonyms, may I back up, just so that we can protect the confidentiality of these families. She started, but after receiving a phone call when we started our study in June, she was immediately ready. She's always been actively involved in her community. She always wanted to help children, but timing was everything. She also informed that once she received that call, she felt so welcome with our staff re-explaining the process and gave her hope on moving forward. Ms. Simon went through the process and was approved in October of 2010. She immediately got placed with the baby shortly thereafter, and she has that child today. Um, this wasn't on my script, but we have been had an issue where the baby was born with some significant health issues due to being drug exposed that were not raised. So actually the county at one point was looking to see if there was some possible form of abuse or neglect. And one of the things that she said to me last week is, I know you all have my back. And it was about knowing our families. The specialized services that we provided were coaching her, supporting her, giving her individual time to walk through these classes and answer her questions. So this is just an example of success of providing those specialized and supportive services that families of color need. Then we have Miss Jackson. Miss Jackson was a single mom. She started off contacting us in 2019 in February, and then the recruiter called her back in March of 2020, and she immediately was ready. Her piece was that she had extremely hectic schedule with maintaining a teenage daughter, but always wanted to be a part of the foster care system and giving back in her community. We had an issue with her with specialized services because she had a citation on her clearance. And most people would have ruled her out. But as Addie Williams says, we needed to be able to overcome that obstacle to rule her in. Since then, she has been placed with multiple children and is a go-to for emergency as well as long-term placements. This situation was different with Mr. and Mrs. Moon. While she wanted to foster and adopt, Mr. Moon was really struggling with that. And if you notice on the initial intake date, that should be July 14th, 2019 instead of 20. But then our worker contacted them in June and started the process. There was a lot of individualized pieces of supports for Mr. Moon to help him go through. So our recruiter was on the phone multiple times explaining to the process, doing one-on-one trainings with him and providing flexible schedules for getting paperwork done. They are in the process of being approved and pending for January of this year. So we're super excited. They should be done in the next couple of days. So through my focused intervention, I focused on the data-driven collection. And I came up with the 3R approach. And we'll talk about that in a moment. But the people that were involved in the training were the recruiters, the profile writers, and the matching worker. And the 3Rs was to review, reflect, and remind. Review staff on why we were here. These numbers were unbelievable, that we went from 114 potential families down to 6 in 1 year. Reflect. What was everybody's part in it? Not necessarily taking it personal, but really looking at what you have done differently to make it more feasible to meet these families' needs. And then remind, why are we here? Are we fulfilling the purpose of the organization of providing stable relationships throughout the community? These were issues that we all left wondering how and what we could do differently. From that implementation strategy, our new approach was fresh and rewarding. It was all about relationships. Relationships being the center of everything that we do. So retention requires relationships, resulting in recruiting rewards. From our new approach, we now contact families weekly. There's never going to be that who the hell is Tom approach, because the workers, whether it's the recruiter or whether it's the profile writer, someone is coaching and supporting that family through each step of the process. Weekly contacts are critical. Our goal now is, instead of families starting in one fiscal year and not getting approved to the next, we are working on 90 days or less of approving families. While our literature review talked about the dropout, our role now is to bring people in and being intentional about how we can service them and provide specialized supports. So this is example of our specialized support checklist. It's designed to keep people on task. It's designed to determine what needs are able and needing for the families, what the financial aspect of it is. If we're looking at paying for clearances, or even one case where we paid for a woman's homeowner's insurance, her apartment insurance for 6 months to get her on board. What did that look like so that we can incorporate it into our budget? But most importantly, through the relationships, we have been intentional about asking what families need to succeed. So where are we at? The number of African American families that completed intakes in July of 2020 is 20. The number of orientations done was 10. And these families now, through this pilot project, we have 10 families approved. We have 9 families placed, and we have 11 families that are in the process of being completed. This collaboration has been extremely beneficial for our organization. We now have a tracking and accountability system that will allow us to not have families drop through the process. While the number doesn't add up to the 20, if you look, it's because we were able to pull other families along that were moving slower by implementing the weekly contacts to keep families moving. Accountability is everything, and not leaving families behind is so critical when the numbers show that we need more and more families of color throughout every state, throughout every country, and every county. So where do I go from here? This information will be shared with Allegheny County, and we're already incorporating it into our new grant on how we will make sure that this exhibit and this research is moving forward to help with this permanency issue that we're currently having. Pennsylvania, the SWAN is statewide adoption network. I will be presenting it when it's offered in the spring. And then my goal is to be able to share this because again, this is not a Pennsylvania issue. This is not an Allegheny County issue. We talked throughout this piece about needing families, but we have to do what we need as an organization to preserve them. And providing equitable opportunities and resources for families of color is the key. That's that specialized support. So this project has allowed us to think completely out of the box. There's been so many barriers, and everybody knows with COVID, but even for us with getting data, initially we thought we would get some specialized data from the county, but that was limited. However, because of this project, they're willing to track things in a different way so that we can see throughout the county the number of African American families that are falling through the cracks upon organization. Being resourceful, looking at what is out there and thinking of different ways to make it happen has been instrumental. This motivated staff. I will be quite honest, when we had our training, staff were just exhausted. They felt hopeless. They felt like that it was truly their part, but motivating staff to be able to move through this process and see the fruits of our labors. It definitely has improved our organizational practices. And I accomplished the PICO. Right now, we have those 6 that we talked about a couple of years ago. And our goal is if we continue by the end of this fiscal year, there will be at least 40 children placed in homes. So that's powerful within itself. My experience, I'm learning how to be uncomfortable with being comfortable. There is so much work that needs to be done. And at times, I needed to stop and reflect and not get overwhelmed, but understand that I'm being stretched to a new way of sharpening my skills. Can't say enough about this experience. The support that I've got through the years, this year has just been amazing. I pride myself on being a part of this fellows. I appreciate the connections that I've received, and these will definitely be some long-lasting relationships. Special thanks goes out to Sherilyn and Arlene. It was trying. Those hippies and coming up with this data was truly stressing at times, but I appreciate so much your wisdom, your expertise, and your grace that you've given to not only me, but I know to others as we move through this process. Special thanks to my mentor, Dr. Williams, and my team for really coming up with new ways of doing the unusual. And one other shout out to our data person, Jenny. If she's on the line, Jenny, thank you. While I was getting on Sherilyn's nerves with trying to pull data, Jenny was right there giving me what I need and helping me make sense of everything. So I truly thank you all. I'm not going to cry, but I am going to say I'm proud and I look forward to what's next in my future. Thank you.